Welcome. I'm Dr. Douglas Cassett, a practicing dentist, or at least I was earlier in March, but I hope to be again soon. I'm a partner in ProfitForDentists.com, a group purchasing organization, or a GPO. The ProfitForDentists.com is hosting this webinar with the coordination and assistance of our two presenters today, RhinoGram and PCI HIPAA. We have arranged this webinar series to help relaunch your practice for success. This is the first of 4 webinars, and today RhinoGram will be presenting on engaging patients through communication, and PCI HIPAA will cover how to do it safely and in compliance with HIPAA rules and regulations, and what to watch out for. The second in the series on May 22nd will deal with supplies, specifically PPEs and aerosol control necessary to protect you, your staff, and your patients. Third will be May 29th and will address billing, laboratory procedures, and equipment. Fourth in the series will address practice management, website, social media optimization, and marketing. We hope you will participate in all 4 of these webinars and invite your friends and colleagues. One last thing before I turn it over to Erica, the sales pitch. You can find us at ProfitForDentists.com. Both RhinoGram and PCI HIPAA will be offering you special pricing if you are a member of ProfitForDentists.com. So go to our website and register. Now, Erica, please give us some guidance on the technical side of this presentation, and then you can turn it over to Abby. Thank you and welcome again.
Awesome. Thank you so much. We are so excited to be here today. Just a few little housekeeping items I wanted to take care of. So if you're looking at your GoToWebinar control panel, you'll see a section for a question box. We've saved time at the end, so if you have any questions, feel free to type them in, and at the end of the session, we'll be sure to answer those questions. We are recording today's session, so if you join late or have to hop off early or need to share this with someone on your team, feel free to send them the recording. You'll get that via email at the end of this presentation. Now, with that being said, I would love to turn it over to Abby Gaddis. She is Director of Strategic Partnerships here at RhinoGram, and she is going to walk through our presentation.
Thank you so much. We're excited to have you here. Thank you all for joining us today. And we know that the topic here is really centered around how can we reopen our practices in a successful way that makes us the most profitable as we can possibly be and give the best possible patient experience. So that I'd love to take you through that today, and that's going to be what we focus on for our piece of the presentation. And we know that there's definitely a new normal in place, and COVID-19 has changed the way that we deliver care, and likely so for a while. And so that means we have to take a different approach in the way that we're engaging patients, to both promote them to come into the office when they do have an issue that can be treated in that way, but also effectively triage and engage with them digitally so that they their needs are being met, before they come in. So that's kind of what we'll cover. What are the key things to prepare for when it comes to patient engagement and successful reopening? Well, first of all of your patients who had scheduled appointments during this time, who reached out to you with problematic issues that weren't necessarily emergencies, and who need information about how your office plans to reopen, your team should be re-engaging them. RhinoGram has a really nice dashboard that allows you to kind of collect your patient population in different groups and blast message them. But it's important to think about the kinds of things that patients want to know. Number one, they want to know what your strategy is for reopening. What are your new business hours look like? Do you have any new procedures that you're asking the patient to go through for check-in? Are you taking any additional precautions around infection control and PPE? Those are the kind of things that are going to keep your patients comfortable and help them to understand what it will be like to come into your office in this new world, and having that information available to patients in a really easily digestible format like text message, definitely on your website and all of your social media outlets, is going to be key. So we'll talk a little bit about that. Effective triage of new issues is going to be really important as well, with limited time in our chairs, and some offices are only allowing one patient in at a time. Really getting to the root of what the problem is, and then preparing with supplies and understanding what each of your patients is coming in for ahead of time is going to help for smoother operations. Certainly continuing to market your practice, but also marketing your practice as a safe, calm, and reliable place to go if you have a dental emergency or if you need dental treatment, is going to be a focus for you going forward. And anything that you can do to improve the digital workflow and keep the face-to-face or person-to-person interaction to a minimum is going to be preferred for your patients. And so that means things like digital check-in, digital payment, and we'll talk about kind of how those work within RhinoGram as well. So what is the best way to engage with a patient? I mentioned this earlier. We know that it's text messaging. Hundreds of data points for us, thousands of data points, lots of research and case studies, and all of the data that's available out on the web with Pew Research says that texting is the preferred mode of communication with businesses and practices. And it's also the way that we prefer to communicate in our day-to-day life. So we encourage you to have a really strong text messaging strategy with your patients. And the great thing about RhinoGram is it allows you to receive inbound communication from existing and prospective patients, and it doesn't have to be centered around an appointment reminder, let's say. And you can also send that outbound communication as well out of RhinoGram. And so I just want to give you some background on how RhinoGram works and how we'd set up your practice, so that you can see how you would use these tools to achieve the strategies that we're going to be talking about. So RhinoGram does a few things to integrate into your practice. One of those things is we would make your main office phone numbers textable, and your voice calls would continue to go where they normally do, but your text messages come into your RhinoGram portal where your staff has access to it. And what that means is anywhere that you market your phone number, you'll be able to market that it is textable. And if you can imagine, most of us text message in our day-to-day life more than we make phone calls. And anything that you can do to make inbound communication to your practice more convenient is going to boost your opportunity for new patient acquisition. There are lots of busy parents at home right now trying to work and care for children at the same time, and stepping away or stealing some time for kind of a lengthy one-on-one phone call might not be the best strategy for them right now. So offering different ways to communicate and engage with your practice that are low friction and convenient are going to be really helpful to boosting that patient count as you start reopening. The second thing that we do is we embed a web form on your website that kind of can replace a chat tool if you're using one. And if you're not using one, it can give your website visitors a way to initiate a text message conversation with you from your site. So the site visitor would enter some information, their cell phone number, and then those messages get submitted to you, and you can follow up through text message, which is great because if I am someone who doesn't have a lot of time and I need to ask a really quick question to a dentist, I may not want to wait on your website for someone to chat me back. In this case, they wouldn't have to wait. They could get their question off their chest and respond back to you. And certainly now, more than ever, folks are going to Facebook and other social media outlets to find out, what are your new business hours? Are you open? What are patients saying about the experience of coming into your practice during this kind of really strange time that we're in? And having information available on that Facebook business page is going to be really important. And it's also going to be very important to give a compliant way to communicate with your practice. Normally, you would not want to have a care-related conversation on Facebook, but because we integrate with the Facebook Messenger API and pull those conversations into RhinoGram, you're giving yourself a compliant entry point. So what we do is we collect all of these inbound communication channels into one easily digestible platform for you and your staff to log into. It's a cloud-based application. You can access it from anywhere. So if you still have some team members that are working from home, they can be watching those inbound messages as well. And creating those low barrier entry points, low friction entry points will allow you to convert more of that traffic to patients. And once we set you up, you're going to get the benefit of all of the features RhinoGram offers. So that can mean two-way texting, but also because we support the exchange of images and documents, you can use RhinoGram to triage issues, provide virtual consultations. We also support language translation, so the patient can message in their native language and you can translate it. That's been a lifesaver for some practices who their full staff is not necessarily in the office, who typically are bilingual. We integrate with your EHR or practice management system to offer you things like appointment reminders and an appointment manager. We give you the tools to offer text to pay payments, and I'll talk a little bit about that. We're introducing live video calling as well. So if you want to do a teledentistry style visit using RhinoGram, you can. And like I said, we pull all of those entry points into one platform that you get to decide through our smart message routing tool where those conversations go. So patients aren't always going to be messaging you about clinical questions. It could be a billing question, administrative question. Maybe they want to get scheduled, and getting that conversation to the right person in your practice quickly and efficiently is the best way to create a really high quality patient experience. So let's talk first about re-engaging your patients. I mentioned this earlier, but if you feel like you're over communicating to your patient base, you're not. The best thing you could be doing right now is communicating. And what that means is giving patients more information about what they can expect when you're reopening, when they can get into the schedule, what kinds of discounts on services you might be offering, anything that you feel might be relevant to them and their needs. And you should be doing that in multiple different mediums. So text message, of course, we love that channel, is a great way to do it. Your website, your social media outlets, anywhere a patient might find your practice, they should be able to see an update on what's happening with your practice. So if I Google you, I want to see that on your Google listing. And that's going to give you more opportunity to get people scheduled. If they're not sure if you're open, if they're not sure if you're taking patients, if they're not sure if you've made adjustments to your strategy for infection control, then they will not be sure about scheduling an appointment with you. So make sure you answer those questions before they have to ask you. Second way is to update all of your channels, like I said, and your patients are really just looking for some information about what to expect. So once you get someone to reach out to you or you've engaged with someone, give them clear instructions on what will happen when they come to the office. If you're asking them to do a car check-in, give them clear instructions on how that will work. If you're offering online payment as opposed to having to use a point of sale system, give them those instructions. You really need to be clear, concise, but if you think you're over communicating, I promise you that you're not. And then the second thing we discussed is really effective triage of patient issues. So if we have limited time on our schedules and we want to make the most of that time, we want to know what exactly the patient is coming in for. And we want to be scheduling our highest acuity patients first. And the best way to get that information is through a really effective triage process. And you can do that kind of thing through RhinoGram as well. So on the left-hand side here, this is actually what the patient experience looks like. So the patient's texting the practice like they would text their friend or family member. They don't have to log into a portal or download an application. And they just sent in a message that says, I'm in a lot of pain. I can't take it anymore. Can you help me? Which is probably sounds really familiar for you. And the practice was able to respond back, ask for a picture, effectively triage and figure out exactly what needs to be done for this patient. And then they were able to kind of get it back to the doctor who reviewed it, and they got the patient scheduled for an appointment. And this allows you to gauge the need for supplies, imaging, tests that need to happen before the appointment, get your highest acuity patients in first, and allow some of those lower acuity patients to wait if you have limited space in your chairs. And it also is always a great practice to remotely triage and collect images, because you're giving your team more information about why that patient is coming in, and you're also making the patient feel like they're getting a really high quality concierge level of service. So let's talk about marketing your practice a little bit. We've talked about marketing updates and changes and things that are happening. But you'll notice here, we've got lots of practices using RhinoGram today that are maximizing social media and kind of making those announcements, offering specials, incentivizing patients to come in now as opposed to waiting till later, and really taking advantage of some of those strategies. RhinoGram also works with several marketing firms as partners that are experts in this kind of thing, and they have out-of-box solutions that can help you get back up and running. So we'd be happy to refer you to some of those as well. But again, just to reiterate, market yourself as open and safe. You have to detail the steps you've taken for patient safety. And really an important step to this is making sure that your team and your staff are feeling safe as well. So listen to your teams, make sure that they feel like their needs are being met, that they have the PPE they need to feel comfortable at work, and that will trickle down to your patients and they'll start feeling that level of comfort and security as well. And then if you do plan to do a new payment workflow, a digital payment workflow, a card check-in like we'll talk about here in a moment, then definitely include instructions for that when the patient gets scheduled. So speaking of digital check-in, this is kind of what that process would look like. Step one is RhinoGram needs to be set up in your office, and then you'll be able to pull up a list of all of your appointments for the next day or 2 days from now. You get to choose really what that list looks like. And we have a tool that allows you to essentially blast out a message to everyone on the list, and it'll be personalized with their name and the name of the person sending the message. And it typically says something like, you know, we've reserved a spot for you tomorrow. We're looking forward to seeing you. And for your safety, we've implemented a new workflow so that you can check in from your car. So when you arrive, remain in your car and text us, and we will text you back when the doctor is ready to see you. And this allows you to promote that. You don't have to worry about them bringing family members into the waiting room with them. You don't have to worry about having your waiting room set up so that people only sit 6 feet apart from one another. This really is a great option. We have hundreds of practices using this workflow today in RhinoGram and seeing success with it. And it really makes the patients feel secure and like you're thinking ahead and caring for them. And then the patient will text you when they get to your office. You text them back when the room or chair is ready. And then as they're leaving, all you have to say is it okay if I send you your copay requests in a text message? They say yes, you hop in a RhinoGram and you can use Rhino Pay to collect that copay, which I'll show you here in a second. So this is what it looks like to make a Rhino Pay request. We've got basically a text message that goes out to the patient. You can see an example of it in the bottom right. It basically says, you know, Dr. So-and-so's office is requesting a payment in the amount of X. Please click here to pay. Patient clicks on the button and they're taken to a screen. They don't have to log into a portal or download any app. They don't have to create any kind of account. Super simple. They just enter their credit card information or the banking information, and it's automatically deposited into your account. And by the way, this kind of text to pay option is great for other things like reducing days in AR, improving collections on your outstanding receivables. Giving someone the ability to make a payment through text message is just night and day, so much more convenient than having to write a check to you or call in and kind of read off the card information, which we don't want to do anyways because it's kind of a no-no when it comes to compliance. So I would say that this tool could be used in every other area of life or kind of all of our kinds of collections in the practice, but especially now when we're trying to minimize interaction with our point of sale systems and keep the patient out of the office as much as possible. If they can pay when they get back in their car, that's an excellent strategy. And you'll have a dashboard and a report that you can look to kind of see all of your outstanding payment requests. You can resend the ones that patients haven't paid for. And it's a really convenient, easy way to collect those copays. So some key takeaways for you. Number one, and most importantly, the care delivery paradigm has shifted forever. We're always going to have to think about how to incorporate digital strategies into our practice going forward. Personally, and at RhinoGram, we believe that's always been the case. Over the last many years, we've seen a shift in patient behavior. They're behaving much more like consumers and shopping for providers. And when your practice is offering that really convenient digital experience, you're just going to have better patient acquisition numbers. We know that because we work with thousands of providers that see those results in their practice every day. So we want to be your partner in that and kind of help support you in your endeavor to digitize a lot of those things. Virtual and patient engagement is going to be a part of all of our worlds going forward, especially since it's a part of, you know, all of our day-to-day lives. We've all kind of transitioned to working on Zoom if we can, and staying at home, but doing more FaceTime, and healthcare delivery is not going to be any different. We know that it is going to be kind of a new world, and patients are really receptive to the digital model that RhinoGram has put forth. And it allows you to kind of have that best of both worlds kind of mentality. You're going to get a great experience when you come into our office, but even when you're at home, you're going to have a great experience as well through text message-based engagement, video calling with the practice, and really feeling connected and well taken care of. And then, like we said, aside from that kind of virtual patient care model, engagement is just so key. Even if you're not providing digital treatment, even if you're not doing teledentistry, communicating with the patient in a way that's really easily digestible for them, like text message, is a way for you to retain your existing patients and give them that great customer service experience. So thank you. We're going to turn it over to PCI HIPAA for the second piece, and we'll be taking questions about RhinoGram at the end.
Awesome job, Abby. Thank you. I love the text messaging. I think that's really cool. I'll get into contactless payments a bit, but text messaging is a great add-on for any practice. So first, just want to thank the sponsors, Profit for Dentists. It's great to be here. My name is Jeff Browdy. I'm the CEO of PCI HIPAA, and our company is really focused on preparing, protecting, and preventing, helping you with just really building some more awareness around cybersecurity and compliance. And my job today, really, if I do it well, is to provide you a lot of information and really surrounding the awareness of things that practices may not be 100% aware of. And you're busy getting back to your practice, you're busy communicating, like Abby said, and communicating with your patients and trying to be safe. I'm gonna present some things that I hope you consider along the way. We have a team of experts in HIPAA and compliance and privacy and security, a lot of partners that help us. And again, Profit for Dentists is one of them, and really appreciate them having us. Before I get started, I'm going to say a lot of things, and I don't want to be held to all of them, so I want you to read this disclaimer really quickly. Great, thank you. Little joke. I mean, whenever you get into the law, there's always the nuances of that. But the first thing is, you know, during this time, bad people still do bad things, unfortunately. And we started seeing this right when the COVID and the coronavirus started to hit, that spam messaging, URLs being purchased related to COVID-19, all kinds of different ways that hackers try to get into your system. And if you think about it for a second, why do you think someone would want to try to infiltrate your system? Why do they want to get into your data? What are they going to do with that? And the fact of the matter is, you're sitting on valuable information. It actually may be some of the most valuable assets that you have in your practice. And just to show you, if you go on Google and you type in "buy stolen medical records," you can see right here, there are tons of articles on what hackers will do with medical records, They unfortunately go on the dark web, not a place that you and I spend a lot of time on, but there is a whole underground of information and websites that are all anonymous, that they actually download a separate browser and they can start selling your information online, believe it or not. And here's just, the cost of breached records, $1 for credit card numbers, up to 100, and medical records can fetch as much as $1,000 on the black market. I mean, that's a lot. Just think of it. If you have 1,000 records at $1,000, my quick math gets me to $1 million in value just on the amount of data that you have. And just to show you, this is a website. This is actually on our web, not the dark web, but they're a lot like this. And you can go in and buy credit card information here, and you can actually buy it online and pay with a credit card. It's ridiculous. It's sad, but it happens. And I can go buy all that information. I can buy CVV numbers, and I take that information, and then I can go sell it, or I can go create identity theft, and I can do all these things that happen. And we talk to tons of practices all the time, and one of their first things is, well, I'm protected, or this isn't going to happen to me, or anything like that. And unfortunately, it does happen. And this is a link to the Department of Health and Human Services breach portal, because if you experience a data breach like this, then you have to report it. It's a self-reporting tool. So you could see this happens almost every day. They update it weekly. So, and it's all types of different, here's a dentist. Hope you're not on this, Lisa. Sorry if you are. But you can see, here's a dentist in Texas. She had 818 records. Again, that's almost worth $818,000 to somebody. And it happens all over the United States, healthcare providers, business associates, all different kinds of types of breaches. So there's hacking incidents, there's unauthorized access, and these are only the covered entities and business associates that know they need to report. So there's a lot of you out there that may not even know that HIPAA has a breach notification rule. I'll get into that in a little bit of what you're required to do. But I just wanted to make you aware that breaches happen, attacks happen, it's happening. It is I'm not going to say a pandemic, sorry. It is an epidemic. I almost said pandemic. It is an epidemic. And again, it's not just the big guys. You can see that there's all types of entities of your size that are getting attacked. And the way they do it is one way they do it is through ransomware. So ransomware is a malicious software that encrypts your data. They go in and it comes in typically through an email download. They will ask for a ransom in the form of Bitcoin, because Bitcoin is a currency, but Bitcoin is anonymous. And they create a sense of urgency. And so what happens is if it infiltrated your system, you walk into your system and you see this screen. Your computer has been encrypted. They are military-grade encryption, and you have to pay a fee for the decryption key so you can get back into your system. And you have 6 days and 13 hours and 43 minutes, or the price is going to go up and up and up and up and up and up and up. And so what would you do in this case? I'll just ask you. I mean, you can't really answer and I can't hear you, but I can tell you when we do ask this, a lot of people say, well, I'll call my IT provider. That would probably be the first person you'd call. And the question becomes some of the things that we're going to consider today, and that I want you to go back to your practice to make sure that your IT provider is doing what you think they're doing. That's very, very important. I'm going to get to that in just a minute. But this is a scary thing. And this happens, I'm telling you, believe me, it happens every single day, all the time. This is one way they infiltrate your system. So things to look out for. the way they do it, my wife shops at Costco, so this is I will never ever go to Costco. I just can't. I can't do it. I used to do it. I can't do it anymore. But my wife still goes, and this is an email that we got from Costco, or a similar email that we got from Costco, and it looks like it's from Costco. This is a phishing email. This is how they get into your system, one way. They will send out an email. It looks very, very like someone that you would use or something that you would do. And you look at it and go, oh, my delivery needs to happen. And you click on this button, it gets into your system, and boom, all of a sudden you have ransomware. Now, it may not just be you, it could be your employees. So this is really important type of thing to educate your employees on. And if you look closely at the top, you can kind of see that this email address, when you click on that, you can click on who it's from on any email, and you can see that this email address is not coming from Costco. It looks like it because it's a wholesale and it's a building, and maybe it is, but this is not a Costco email. They created that email address to phish one of your employees. Here's one from PayPal. Again, we all use PayPal. We have my account's been suspended on air. There's a sense of urgency. I don't want to lose my PayPal. What's happening? I want to update my information. And this really looks like it could be from PayPal. Again, when you look closer at the top, you kind of see that, no, this doesn't look like a PayPal email address. So I'm not going to click on this. I'm just going to delete this, if you know. And this is actually a really good site just to spend a little bit of time with your employees and yourself. Is you can go take a quiz, phishingquiz.withgoogle.com, or you can just Google, if you don't remember this email address, it's phishing quiz with, you can just type the search and this will come up. It actually takes you through a series of emails that I just went through, a lot like that, and it'll tell you where to look and what to look for. It's a great thing just to have your employees go through, because your employees are your first line of defense, and you want to make sure that they understand some of those risks also, because they're going to help protect you as we move forward. But no matter what you do, this stuff still happens, unfortunately. And this is actually one of our clients, Dr. Sharma. She's approved for us to have this discussion. And she is part of our compliance program and cybersecurity program, but she wasn't using our data backup as a secondary source. And we often tell clients that's important. I'm going to get into why. But she wasn't using us. She got hit with a ransomware attack. She had a lot of records. She's been in practice for over 30 years. She was actually right in the middle of selling her practice. They were in escrow, and she got hit with a ransomware attack, couldn't get into her system, did not know what to do. We have an incident response team that helps practices get through this, but you can see that the fees add up pretty fast. So we negotiated the ransom. We actually have a Bitcoin account to help practices get through this and determine whether they should pay it or not. So we paid a little bit of money. We got some of the data. It looked good. We were able to start. We brought in a forensic team to kind of help with that process because she had a lot of information. We brought in a legal team to determine what Dr. Sharma needed to do legally, whether she needed to notify her patients, what she needed to do. And the bills added up to almost $200,000. That could cripple a practice if you don't have the right protection. And we're going to talk about some of that protection. Now, just to make you aware of some of the other things that are happening, it's not just going one-to-one, it's evolving. So there were two Wisconsin IT providers that got hacked through their software, and they had hundreds and hundreds of dental practices that they were doing IT services for. So the hacker actually, instead of going directly through an email, they came through the IT provider software that was connected to the practice for monitoring or for doing data backup. They came in through those systems and hit all of them all at once. This is why you need a secondary source of backup. Because if your IT provider gets hit, if your practice management software gets hit, you're going to stand in line like everybody else. They're small businesses. Their phones are ringing off the hook. People can't get to their data. They don't have the resources right away to get you back up and running. So you have to be aware that that ransomware and attacks are evolving. They're not just going one-to-one, but they're starting to hit some of your trusted providers. And just ask yourself, what would you do? What would you do if you came in and got hit? If you had a ransomware attack? Well, I'll tell you, under HIPAA's breach notification rule, like you saw on the breach report portal, you're actually required within 60 days to report that. So it's self-reporting. It goes to the Office for Civil Rights. What they will typically do is they have a backlog, but they will eventually come in and see what safeguards did you have in place at the time of the breach. Did you have policies and procedures in place? Did you execute business associate agreements? Did you have the technical safeguards regarding encryption? Did you train your employees? Can you show that you trained your employees? And not only do you have to deal with the data breach, but then you have to deal with the law, because HIPAA is the law. So you have to, I mean, it's a lot to go through, obviously, on your own. We help Dr. Sharma through a lot of this, forensic investigations. You have to actually do a press release to notify your patients if data was compromised. And if you experience a real breach, you have to show that. You have to set up a call center to make sure you can take those calls from all your patients. There's a lot that needs to happen, and you have to be aware of that, because if you don't, and you don't follow the notification rules, again, not only are you dealing with the data breach, but now you're dealing with the legal requirements under the HIPAA's breach notification rule. So what could you do to help prevent this or help protect yourself? The number one thing right away to consider is this is probably one of the most important slides of my presentation. You got to do data backup, and you have to make sure that your data is encrypted, it's off-site, and the most important thing is that you can restore it. How could you restore your data in case this were to happen? Talk to your IT provider. Make sure you know how to do it. Make sure you have multiple sets. Make sure that if you had a ransomware attack, that they can restore that data and get you going and operating quickly, so you don't lose patients and you don't lose revenue and you don't have to pay the ransom. The other thing is you need cyber insurance. Cyber insurance, no matter what you do, no matter what precautions you take, if you don't have cyber insurance that covers the attacks and fines and notifications, there's no protection, there's no financial protection. You are way more likely to use a cyber insurance policy today than you are your malpractice policy or your general liability policy. I'm telling you, I see it all the time, and you can read up on it. Cyber insurance is critical for your practice, just like malpractices. Virtual networking, you're working from home. I'll touch upon this a little bit. There's definitely risks of I know you're getting back to work now, but when you weren't, and we may have to go back, just consider you got to get a virtual private network. You have to log in on a very secure network to get into your network and your systems. You want to make sure your passwords are changed and updated from the manufacturer. And you want to make sure that you're never using your laptop in a public Wi-Fi format, especially when you're dealing with sensitive information. They're waiting for you at Starbucks, or if we ever get back into Starbucks, they're waiting for you to do that, and they're waiting for you to get into a hotel lobby to see what you're doing. And you want to make sure when your employees or you're working from home that all of your operating systems, all of your antivirus software and firewalls are all up to date. They get in because passwords are not up to date. Okay, real quickly, we surveyed 1,000 practices just like you on getting back to work. Okay, we asked them some questions. 61% are already thinking about, hopefully you fall in this group, are what you're going to do differently around patient and employee safety. Some weren't sure yet, some had some thoughts. Some of their initial thoughts, which you may be thinking about, is obviously you want to make sure that your patients and employees are kept safe. We talked about contactless payments is important. Abby talked about family members waiting in the car. These are all things you're thinking about, one practice at a time, spacing it out, PP&E, infiltration of systems, filters, keeping the office and the aerosols cleaner, testing employees, All these kinds of things are what practices are thinking about. Their concerns in this area are about getting the equipment, getting the supplies, how to, Abby mentioned this, communicating with patients, how to control your aerosols, how to social distancing, seeing less patients. You're probably thinking about all the same things. This is just confirming a lot of those things on what to think about and what you need to do. Three things that that you must think about is, do you have a preparedness and response plan in place? How are you going to communicate to your employees and patients? And are you using contactless payments? Because no one's going to want to touch. Do you have a contactless device? Does your credit card terminal use that? These are all important things, as well as other things that you've probably considered. These were my favorite COVID-19 logos, especially the NBA. They're all not playing, so they're hanging out. I kind of like the mask on the Starbucks woman too. And then here's some actual FAQs really quickly on your employees that many of our practices are starting to ask us. So in light of COVID-19, what information can you ask your employees to provide? So you can ask for test results. You can ask if they have symptoms. You can ask where they traveled to, and you can identify who's at risk and who's more at risk. So you have, or if they've been self-quarantined, because your job is to protect your employees, obviously your patients too, but you got to protect your employees. Another thing, can you ask your employees to take their temperature? Yes, you can ask them that, and you can ask them to take their own temperature and report it. Now, you can't share that information with other employees, but you can ask them that as you, the owner, to make sure that they're being protected and the other people aren't, at your patients and your employees aren't harmed. If they're over 100.4, which is the number, you can actually have them go home to protect the practice. Also, can you require them to be tested? Yes. If there are symptoms and they're showing symptoms, you can require them to keep the workplace safe to get tested, but you cannot share that information with another employee. You can't disclose the person's name and what happened, but you would have to disclose, and you should disclose, that someone may have been exposed and we've been exposed and what to do next. Okay, so real quickly, this is kind of what we do. I know I went through a lot of information, but we focus on protecting you and giving you information, especially during this time. These are unprecedented times. You need the support. Your office managers need the support. You can't go at this alone. You're putting yourself at too much risk. And what we do is we do all of this for you. We have a portal that has all the policies and procedures you need. We have a checklist of what you need to do. We provide you with that cyber insurance just by signing up. You get it with us automatically. We have a secondary source of backup for you, just in case your IT provider, and you should be having a secondary source. We actually do all your employee training for HIPAA all online, and we are now adding an OSHA product on June 1st to handle all of your occupational safety issues, including preparing that COVID-19 plan and getting back to work, because Congress is going to make you do that. That's going to be part of the stimulus package. Every single business is going to need a COVID-19 preparedness and response plan. We have set up a website for you, PCIHIPAA.com/profit for dentists. Go there, and you automatically can get 2 CE credits for free. We've put that for everyone on this, that you can go and actually take an online course. It goes into a lot more detail of what I went through, but you can satisfy your HIPAA training. You can get your CE credits. We're giving it as a good karma offer for free for all the Profit for Dentist users. Just go online and do that. And then also, our product is $240, all of that, the cyber insurance, the access, the training. It's $249 a month, but it's only $199 and free during this time, so you don't have to think about it and get back to work. You just go there and sign up. You don't get billed. 60 days free. Go online, get trained, learn about it, start talking to our people, and get your cyber insurance in place right now, today. If you don't have it, go get it. You get it free for 60 days, and then you'll learn about our program. If you have any questions, email me, jeff@PCIHIPAA.com. I will answer all of them for you, or I'll get someone to answer them for you, but I'll respond to you, and I'll send you my presentation. If you want it, you can have it. So again, thank you very much. Appreciate you having. I know it was only 20 minutes. I probably went over. I'm sorry about that, but I will now, well, 22 minutes, okay? So I went over 2 minutes, sorry, but go to PCIHIPAA.com, Profit for Dentists, take advantage of our free services, and email me, text me, or just, I didn't leave my number, but email me if you have any questions, and I really appreciate you having me.
All right, we have a few questions here. Let me just gather these. We have a question. What is the benefit of being a member of Profit for Dentists?
Well, I'd be happy to answer that, Erica. This is Dr. Cassett, and I am a partner in the ProfitForDentists.com. And the advantages are that we offer access to lots of vendors similar to RhinoGram and PCI HIPAA that we have vented and engaged to offer the goods and services that dental practices need at a reduced cost. Our mission is to help control overhead costs for the dentist and make your practices more profitable. So our website is Profit For, and it's a four, not a F-O-U-R. It's Profit number 4 dentist.com, and you can take a look at our website, see who our vendors are currently. We are adding them weekly as we mature, and we look forward to having you as a member.
Awesome. Okay, so it looks like we have 2 questions for RhinoGram. So Abby, I'll let you handle these. We have, how is RhinoGram HIPAA compliant?
That's a really great question. And I want to answer that, but first I want to thank Profit for Dentists again for having us and hosting this series. And I know that your kind of grouping of vendors is a top-notch group of people to work with, and we're just honored to be here. And this is a very compliance-focused webinar, so I'm glad we had a question around compliance. RhinoGram does a couple of things to help you maintain your compliance. One of those things is that we provide you a password-protected, encrypted, secure portal where you log in as a staff, and we secure all of the communication that you store with your patients. So all of your communication records, your history, etc. And what that also includes is the ability to secure, or rather collect HIPAA consent from your patients to use a medium like texting or social media messaging. So we have a tool that automatically will give you the ability to send a message to a patient to collect their consenting around this kind of communication. Once you collect that consent, you can log it in their RhinoGram record, and it will become visible to everyone who's looking at that record, that whether the patient has given consent or not. So if the patient doesn't want to text with you, it'll be abundantly clear to everyone that they don't want to text. We don't ever see that happening. Patients typically do want to text, and when they say yes, then it will that will also appear on their profile. So as a covered entity, you really have 2 responsibilities. One is to, of course, secure and protect the data that you're storing, and the other one is to make sure the patient has information about the risks and benefits of using digital communication like texting, and they have the choice to either grant or provide their consent to you. And we give you built-in tools that help you do both of those things. And I would add that one additional thing that we offer, which you will not find in most platforms like ours, is a very detailed audit log of all of the communication that's ever happened and all of the activity that happens on any patient record, which is required for things like EHR systems and practice management systems. RhinoGram is actually ONC certified for secure messaging, which on the medical side means you can get reimbursed for using RhinoGram, but what that also means is that we've gone through a really rigorous security assessment by the government, and they've kind of given us the seal of approval when it comes to that kind of workflow.
Great. We have a question that's also for RhinoGram. How do patients log into RhinoGram?
Yeah, so that's a common question, and I think it's a little tricky because you, of course, will be logging into RhinoGram and using the portal, but the patient doesn't really know RhinoGram exists because they are texting you or social media messaging you like they would text their friends and family or message their friends on social media. They are literally saving your phone number in their phone or plugging it in and sending you a text message. which is why we have such high adoption rates on this kind of technology. And it's also why we are able to create that low barrier, low friction communication channel that helps you increase your patient panel and really engage folks who might otherwise not wait on hold for you or kind of go through a lengthy form on your website. That millennial population who's a digital native and they're really used to kind of seeing everything happen in real time and having convenient access really appreciate that communication channel.
Awesome, and it looks like we have just under 10 minutes, so just a reminder, if you have any questions, please feel free to type those into the GoToWebinar control panel. If we can't answer them here live, we will make sure the right person follows up via email or phone call to answer those questions. So Jeff, it looks like we have a question for you. Can PCI HIPAA do any assessment of my vendors so I know that I'm partnering with the right ones?
We have a risk assessment that your vendors could take, and it goes through about 42 questions around the safeguards that they need in order to be HIPAA compliant. You can have them take it. We can send you the report, and they can have a discussion. We don't go in and do technical safeguards. That's not typically what we do. We're more focused on we do some of the technical safeguards, but we don't go on site if that's what you're referring to. I guess it depends what kind of vendor you're working with, but also happy to have that discussion with you if you have some concerns. Now, one thing that you should always consider when you deal with a vendor that will protect yourself is make sure that you have a business associate agreement in place with them. So anyone that you're providing information, protected health information to, it's now required that you have a business associate agreement with them, and that we enable our customers to easily be able to execute business associate agreements. The most important part of that agreement is the indemnification clause, so that you get indemnified in case something happens with that information while your vendor is handling it, if they have a data breach. If you don't have that business associate agreement in place, you may not be protected as well as you should be.
All right, perfect. And that looks like that was all of the questions that we have here live. Dr. Cassett, do you want to send us away?
Yes. Let me just thank everyone for participating today. And remember, go to profit4dentists, that's plural.com, to sign up and then be able to access RhinoGram and PCI HIPAA and their special pricing for today. We look forward to having you participate in the future webinars, and have a healthy and safe Friday. Thank you so much.
Thank you. Bye, everyone.